Welcome to this Arrhythmia Alliance communication for all arrhythmia patients in the UK and beyond. We are currently in the midst of a global pandemic with COVID-19. These are unprecedented times, and the Arrhythmia Alliance network wish to reassure all arrhythmia patients that they are being thought of and will be looked after. These are truly frightening times as we are bombarded by news items 24/7, and many of you may be quarantined, self-isolated or unwell, or perhaps have vulnerable family members to be worried about. These concerns also apply not only to patients but also to healthcare workers alike, but the medical profession is here to look after you, and we must look after each other. You will notice a change in services, and the fundamental principle is to limit direct person-to-person contact to minimise unnecessary exposure to the virus. COVID-19 is actually spread mainly through respiratory droplets and also close contact with an infected person, but the virus may also spread by contact with contaminated surfaces. One of the first measures or change in care practices that you'll have noticed is that face-to-face visits to hospital for clinic appointments will have been likely converted to virtual healthcare visits, either via telephone or video consultations, unless deemed very urgent by the clinicians or hospital team. Many of you will have had already or imminently will have arrhythmia treatment procedures cancelled. Please don't worry about this, because these decisions will have been conducted after appropriate risk evaluation, with cancellations for patients that are clinically stable and not urgently needing interventions. The types of procedures that are likely to be cancelled and or postponed include catheter ablation procedures for non-urgent arrhythmias, for electrical cardioversion treatments, which is the electrical shock treatments, and non-emergency cardiac device implantation, including the insertion of implantable loop recorders. It is important to remember that this type of prioritisation helps conserve precious resources, such as personal protective equipment required for healthcare workers in this pandemic. For those patients who already have a cardiac device implanted, such as a pacemaker or an ICD, routine visits to hospital for face-to-face checkups on device function will be cancelled or postponed, and this is important to reduce both patient, healthcare worker and equipment exposures that may enhance the spread of the virus. Many patients will have remote monitoring functions of their devices, which allows for important follow-up without face-to-face consultations. However, not all devices have this function, but for those that do and who are not currently enrolled in remote monitoring, hospitals will be actively considering this option. If you are coming in for an urgent procedure, you will likely be screened for whether you've had a fever, cold, cough, and any other related symptoms, as well as any high-risk travel and any exposure to high-risk contacts. Although there may be variability from hospital to hospital and country to country, rest assured we are trying our utmost to offer the best possible care in these challenging times. Above all, my parting message is please stay safe, stay well, and wash your hands.